Hello, good evening everybody. Good evening and welcome to Eyecare Online. Eyecare Online episode 3. Wow, we are growing. Good evening everybody and welcome. My name is Dr. Doris-Optometrist. I am an optometrist. And Eyecare Online is a program designed to answer your burning eye care questions, right? So if you have any question that you couldn't ask your optometrist or your ophthalmologist when you went to have your eyes checked, bring it to Eyecare Online and I'll do my very best to answer them. I understand that most of the time, by the time we go to visit an eye clinic or we go to the hospital to have our eyes checked, for those of us that go to government hospital, the crowd can be overwhelming. The doctors may not have the time to sit back and explain everything in details, to you, telling you everything. So this is where I try my best to bridge that gap, all right, so that you at least have an idea of what you're treating, what exactly is wrong with you, and the kind of drugs that you should take, and every other thing that I can possibly answer on social media. All right, and so I hope you can hear me. If you can hear me, kindly indicate I can hear you very well. The first 2 episodes that I did, I had issues with audio, all right, so I'm trying my best to see how to correct it. So you can see I'm using a mic today. So if you can hear me very well, please tell me I can hear you. If you can see me, if the light is too dim or it's too bright, just let me know, all right, because I want this to have a very good audio and visual quality for you. All right, so over the last couple of days, I was able to pick 7 questions like I usually do. Every Monday, I pick 7 questions out of many questions that I get, and I try to answer them. Now, these questions I select, I try as much as possible to make sure that it cuts across every aspect of the eye care, of the eye, whether it's pathological or it's something that requires glasses. Okay, so I picked about 7 questions from 7 different people. So if your question is not here and it's not, and in the course of this tonight's episode I don't get to answer that, please send me a DM and tell me again that your question was not answered, and I'll do my best to answer it on DM, right? Okay, so even though this is supposed to be a 1-hour program, I tried to see how to make it 30 minutes, 45 minutes, because hey, today is Monday and most of us went to work and we had long days, right? Like today I had a very long day. All right, so I'm gonna see how to make this as brief as possible, still giving you the right information or the information that you need to have. All right, so the first question is from Peace, right? So Peace chatted me up on WhatsApp from Facebook, and her question is that she asked, what is refractive surgery? Now, before I answer that, the little I got to know about Peace was diagnosed of myopia, which is short-sightedness, and then her power is very high. And she was told that the best thing for her could be refractive surgery instead of her to wear glasses. So now I'm going to answer this. Now, refractive surgery is a surgery that we do, that not we ophthalmologists do, all right, for people that have a high refractive power. For example, if you are short-sighted, if you are long-sighted, instead of maybe you are above a certain number, sometimes you look at above 15 diopters and upwards, instead of wearing those very thick glasses, or even with the thick glasses you still can't see very well, we recommend that you go for refractive surgery. Now, yes, now the most common refractive surgery is called LASIK, right? This is where they use laser to kind of shaping your eye so that you'll be able to see well or see better without those thick glasses. But the problem with refractive surgery is that there is no guarantee that even after the surgery you will not wear glasses. Instead, what can happen is this. Let's say, for example, your error is about -20, right? And you undergo a LASIK surgery. Now, what the LASIK does is it can reduce from that -20 to like -5. So instead of you to wear -20 glasses, you end up wearing a -5 because there is a correction of -15 that has happened, right? So it doesn't, sometimes you still have to wear glasses even after surgery. Now, another thing about surgery is that sometimes it doesn't turn out the way and that you expect. There could be risk, there could be complications. That is why before you ever consider going for surgery, going for refractive surgery, you must have to look at the benefits. It must have to outweigh. You have to look at it. What if something goes wrong? What if something goes wrong? So you have to look at it that way. Now, I'm not saying that it's not good. There are amazing surgeons that can perform refractive surgery very, very well, right? So it's for you to discuss very well with your ophthalmologist to know if he's a specialist in performing LASIK. So refractive surgery is when they do this surgery so that you don't have to wear those very thick glasses or those very thick lenses, all right? Okay, so please, I hope that's helped. So for your power, I think yes, you can benefit from LASIK, from refractive surgery, but you have to be very careful who performed the surgery for you. So second question comes from Eric. Eric said, what can I do? I always experience burning sensation, especially while using my phone. Alright, so now to explain Eric's problem, Eric, every time he uses his phone, experiences burning sensation. For us to go into that, we need to understand what is called computer vision syndrome. One of the symptoms of this computer vision syndrome is burning sensation on the eye. By the time you are always exposed to your screen, the rays of the light is on your screen. You are, most of us, from the time we wake up as soon as we wake up, we are with our phone to check who sent us message. So your eyes are exposed to ultraviolet rays from the moment you wake up to when you go to bed. Even when you're not on your phone, you go out under the sun, you are still exposed to these rays, right? So definitely you're going to start having this kind of all symptoms, eye fatigue, burning sensation, tears coming out of your eye feels tired and all that. You're going to experience all that. Now, but what do? First of all, you have to cut down your screen time. That's number one. Then number two, practice the 20-20-20 rule because this ensures that your eye gets some rest. If you don't know what the rule is by now, that means you missed episode 2. All right. So what that means is for every 20 minutes you spend on a system, right? Look 20 feet away for 20 seconds. So practice that rule, and it will definitely make your eyes feel better. So experiencing burning sensation when you are using your phone is part of the computer vision syndrome. So what you need to do is just try as much as possible to rest as much as possible when you are on your phone. Okay, Eric, I hope I'm not speaking too fast for you. So that is it. So that's why you're experiencing that burning sensation. Now I got this message from hi, I can see many people. Hi Christian, Choma, AB, how you guys doing? Welcome to Eyecare Online. Alright, so I got this from Twitter. Okay, a friend reached out, because we are friends on Twitter. Oh, phone us, I don't know what the friends, yes. Reached out to me and he said, my 4-year-old daughter's right eye gets teary, even if she isn't crying. What could be responsible for this, and what advice can you give me? Alright, so first of all, the question is incomplete, right? When it comes to kids, there could be other signs and symptoms and other questions that we ask when they come to see us at the clinic. Now let's assume that this child, is an inpatient. The first that I don't know what just happened. My network I hope I'm back. Okay, I'm back. I believe I'm back. Alright. Okay, so if the patient is an inpatient, the first thing I'm going to do is to ask questions about the birth. Is there other signs and symptoms? Are there other signs and symptoms? Is there itching? Is there pain? There are so many questions I could ask, right? Because sometimes this tearing cannot just be on its own. Sometimes the child could be itching, right? So we don't know that, right? So this is not, is incomplete. So what I'm going to do, because I told him to, watch this episode. So my advice to you, as you ask, my advice is, take your child to the clinic. Let them examine the child. Tearing could be due to refractive error. It could be due to pathological issue. It could be due to allergy. It could be due to something as simple as, allergy. It could also be due to duct, the blocked, that sphincter, this hole here is blocked. We expect to find a lay way to explain it. That hole here is blocked. It could be due to that. It could be due to anything. So the question is incomplete. So I will advise that you take the child to the clinic and then have the doctor examine her and know what exactly is causing her to tear, even when she is not crying. With kids, I love being, very, very careful. I don't just say things. I just want to be very careful with them. So the fourth question comes from Praise. Now Praise said this: I got my glasses a couple of days ago from a clinic. When I put it on, it was clear, but I think it was too clear. So I haven't worn it since. Do you think I should wear them? Alright, so Praise, first of all, whenever I'm using my clinic now, for example, whenever I give patients glasses, I tell them this: we'll call you 24 hours and then we'll call you a week after, right? Now we expect that if you have been someone that is not wearing their glasses, or that is meant to wear glasses but you weren't wearing it, right? And they're giving glasses for the first time, we don't expect you to just be comfortable immediately. We expect that you feel the difference from your naked eye to the glasses. There has to be some adjustment or some adaptation. Hi, thank you so much. Thank you. I can see all the hearts. Thank you so much. So we give you room to adapt, which is why we call you a week after. So whenever I give patients glasses, I tell them, you know what, wear it. Unless you are having severe headache, unless it is extremely uncomfortable, right? Then immediately you observe this, stop wearing it and give the clinic a call. That's why when I was doing Eyecare on radio on Saturday, one of the things I talked about is that you should try and get your doctor's number. The least you can get is the clinic number, right? So when things like this happen, just call them and say, I'm experiencing severe headache. Okay, I'm experiencing severe discomfort, I can't continue. But don't discontinue and keep quiet about it. I've seen patients that that come to me and tell me, I was giving glasses in this clinic 2 years ago, I was not comfortable with it and I stopped wearing it. And my next question usually is, did you get back to them? And the answer is no. Why not? You paid for the glasses, you paid for the test, so why don't you get back to them and say, hey, this thing you gave me, I'm not comfortable with it. Right? Because to the clinic, you are fine. And some clinics do not actually follow up very well. They don't call to follow up to know how you're doing and all that. So once they give you the glasses, they are done with you. So you have to get back to them and say, I am not comfortable. But usually I suggest, except if the pain or discomfort or headache is really, really pronounced, give yourself a week. Most times you find yourself adapting to the glasses, most times you find yourself adjusting or not, and either way get back to the clinic. Alright, so Praise, my answer is try and put it on. Alright, if after 1 week you still feel the discomfort, like you said, it's too clear, after 1 week if you still feel the same thing, get back to the clinic and have them replace it for you. Alright, so the fifth question came from Idongesit. Now she said, or he said, Doc, the clinic I went to told me I am short-sighted. Please, what do they mean? Alright, so for me to explain that, I have to talk about refractive error in general. Refractive error happens to, it means when you're not able to see something clearly, at far or near. You can't see something either at far or at near. Sorry about that. Okay, so most times people that are short-sighted can actually read. They can read very well, they can see, no matter how tiny something is, they can actually see it. But things that are far, they can't see it, right? So if some people tell you, I can read no matter how small it is, okay, then try and see far. So when you're short-sighted, you can read your books, you can see and all that, but you can't really see for that what it means. So basically, they're going to give you a lens, we call it a minus lens, to be able to correct correct the vision, okay, to ensure that you see things at far very well. Now, one of the people that are short-sighted, sometimes they feel that they can read, as long as they can read, they are fine. Therefore, they don't bother, trying to get to the clinic and all that. It's very important that you also always have your eyes examined regularly. This is because even if you're short-sighted and you can still read and you are straining your eyes to see far, you experience symptoms such as headaches, blurred vision, migraines and all that. I mean, just a pair of glasses or contact lens can solve that problem, and then you have your vision back. Okay, so in other sense, that's what it means. It means that you probably need glasses to see better at far, even though you can read well at near. Alright, so we are making progress. 2 more questions to go, and I'm out of your sight tonight. So if you have more questions, I think I have to increase it to 10 questions per night, right? 7, we are finishing too early. Yeah. Okay, so this is from Jessica. Jessica said, a minute please. Jessica said, my eye is always itching me. I have used different drugs and eye drops. My mom gave me vitamin A, which I have been using, but the itching still persists. Please, what can I do? Sorry, I can't see what you wrote. I am tired of scratching my eye. All right. First of all, Jessica, vitamin A. Vitamin A. All right, let me start with vitamin A. I have seen patients that tell me, I've been using vitamin A every day for the past 2 months, for the past 3 months, because they want to avoid wearing glasses, they want to avoid, going to hospitals and all that. There's something we call drug toxicity. People don't know about. Too much of everything is bad. Vitamin A is not something that you are supposed to swallow every day. It's not something that you're supposed to swallow just like that, right? Vitamin A is a supplement that you're supposed to take only when you need it, only under prescription. When you have such toxicity, when you have too much of vitamin A in your body, it kind of damages the eye. So going to pharmacy to just buy vitamin A and be swallowing every time, it's actually not healthy for you. It's not good. Take your medications under prescription. The doctor that writes vitamin A for 5 days knows what they're doing. They write for 1 week, they know what they're doing. Alright? So yes, it's not good to be deficient in them, and it's also not good to have them in excess. That is why when you are a kid, you are given vitamin A as a baby. There's a reason for all that. So Jessica, taking vitamin A because you want to prevent scratching, because your eye is itching you, is, I don't know the word to use, but you are kind of trying to cause a huge problem over a minor situation. What causes eye itching? Eye itching could be due to allergy. You are reacting to something. You are reacting to powder, cream, soap, makeup, detergent. For example, there are certain detergents I can't use to wash because it makes me sneeze. There are certain insecticides I can't use in my house because it gives me rashes. My kids as babies, there are certain baby soaps they can't use because one of them is there bringing out discharges. Alright, so itching could be a sign of allergy. That's number one. Then itching could also be a sign of refractive error, meaning that you need glasses. Right? So it could also be that all you need to just get a pair of minor lens, small powered lens, and wear. So now imagine you trying to take care of that, and then you create what we call ocular toxicity or drug toxicity just because of that. And then when that happens, no matter the kind of lens we put, your vision does not get improved. So if you are like Jessica and you're always going to the pharmacy to buy supplements and just swallow it because it's available, please stop. Please stop. Right? If you have, there are vegetables, there are fruits all around, get them in the natural form. In my clinic, I don't prescribe supplements to young people. I don't, because I believe that your organ, your intestine, your liver, everything is still strong and is still working. So why would I want to prescribe supplement that's supposed to supplement what you can produce when you can get them naturally? So first of all, Jessica, please stop the vitamin A stuff that your mom gave you. I know your mom means well, but please stop. If your eye is itching, you go have your eyes examined so they can actually since from what you wrote, it's been going on for some time. So it's something that you should check out. If it's allergies, start elimination process to know what you are reacting to. All right? It could be something as simple as changing soap and you're fine. Changing detergent and you're changing environment and you're fine. Okay? So please stop with the vitamin A. Right, and then go have your eyes checked. Then our 7th question, and the last question is from Mfon. Okay, Mfon said, my dad is 68 years old and has been diagnosed of glaucoma for over 10 years. He has been on eye drops, but his vision is not improving, but seems to be getting worse. Please, what else can we do? Oh, okay. First of all, I am so sorry to hear that, and my love to your dad and all that. But first of all, vision lost due to glaucoma is irreversible. Okay, and that is why for the past couple of weeks, all I've been talking about doing eye care on radio here in Comfort and 5.1 FM, it's glaucoma, glaucoma, glaucoma. And coincidentally on Saturday, I talked about how you can prevent glaucoma. But the truth is, you can't prevent glaucoma. You can prevent vision loss, right? And how do you prevent vision loss? By early detection. Okay, so now your father was diagnosed 10 years ago. I don't know the stage the vision was, and since the vision is getting worse, I need us to understand something. What the eye drop does is to slow down the progression of the glaucoma. I think I have to take that again. What the eye drops do is to slow down the progression of the glaucoma. Does it entirely stop it? Just the eye drop? The answer is not really. It slows it down, right? There are other things you can do to really slow it down more. You can opt for surgery, because if he's 68 years old now, he's 8 years old now, that means he was diagnosed when he was 58 years old, right? So I don't know why your optometrist did not recommend surgery. I don't know if there are other health challenges. But if he has surgery, what surgery does is surgery helps to reduce the progression further. Okay, so now when you have the surgery done and then you have the eye drop, of course the progression is reduced very, very well. Like literally the vision that is there is what will be kept. Because what surgery does is surgery tries to keep the vision as it is. So for me, when I see people that have glaucoma and it's let's say about 50%, right, and they are young, and I look at their visual lifestyle, they still, and all that, and their health is good, I recommend surgery for them. What it does is it helps to retain the vision. Even if they still need to use the eye drop, at least we are not afraid of the vision getting worse or the blindness or the glaucoma progressing. So in this case, I would recommend that, first of all, I would like to see your father if you are here in New York, because I would like to grade the glaucoma to see how it's progressing, to actually know, is it actually progressing, or you guys were expecting, or you guys had a high expectation that is not being met. That's another thing. So I hope this helps. I would love to see you, and every Thursday we have a free screening here at Natal, so I would love to see you. And this month we're still doing free glaucoma screening, so yeah. So I'm trying to give you to take care of every excuse you have for not bringing him over. So I would love to see you in fun. I would love to see your dad, so that by that way I will know exactly the grading of the glaucoma, and then know if he's progressing, and then know if he's still a candidate for surgery, and probably recommend one for him. Wow, that was a fast one. I beat my record, less than 30 minutes, 7 questions. So everyone that has been watching, hi Edu, I can see you. Hi Abbas, thank you guys, thank you so much for watching. I see all of you. So if you have questions, from next week I'm going to increase it to 10 questions, so that I can get more questions in. If you have questions, please do go ahead and send me a DM. Drop it in the comments, send it through Facebook Messenger, send it via WhatsApp if you have my personal number or my clinic number, and I will do my best to answer that. Now, the purpose of all these things I'm doing is to share information and to create awareness, but the most important thing is that I hope it motivates you and inspires you to go have your eyes examined. Sight is wealth, right? And most of the time when we have issues in our eyes, as long as we wake up and we can see, we feel everything is fine. But early detection is key. By the time you notice that something is wrong, it's probably too late. So please, don't just keep this information to yourself, right? Spread the information. Ask your neighbors if they have gone to have their eyes checked. Especially if you are above 40, or you have someone that's above 40, you have a high risk factor of issues like diabetes, hypertension, and all that. And then if you've had injury or trauma to your eyes, just go and have your eyes checked. If you're always exposed to your phone, to your laptops, and all that, try and get computer lenses. It will definitely help you. All right, so thank you guys so much for being part of Eyecare Online. 3rd episode, we are growing, and I hope to see you guys next week, Monday. Good night.